Welcome to the Deep Dive. We're here to unpack the latest insights so you're not just informed, you're genuinely ahead of the curve. Now, we all know sleep is, well, fundamental for our health, that's a given. But what if how you sleep, the actual position your body takes for hours every single night, is quietly shaping your brain's future, potentially increasing your risk of stroke, even dementia, especially as we get older? Today, we're diving deep into the surprising link between sleep posture, brain health, and stroke prevention. It's a critical topic, honestly, often missing from the usual lifestyle advice. We've gathered insights from some top sources, studies from the American Heart Association, Johns Hopkins, Science Daily, Optoceutics, plus perspectives from medical practitioners. Our mission: to uncover some surprising facts, understand the mechanisms behind it all, and give you actionable steps to optimize your sleep for a healthier brain, particularly as we navigate, the later years.
That's exactly right. Adequate sleep, that 7 to 9 hour window for most adults, it's foundational, no question. It supports every system: heart, brain, blood vessels, immune system. That's well-established science. But the really fascinating layer here, the part often overlooked, is that while sleep duration is key, emerging research really highlights that sleep position can matter significantly, especially for our brain health. See, our brains have this incredible housekeeping system. Scientists call it the glymphatic pathway. Think of it like plumbing for your brain. Its job is to flush out waste, and this system works best when we're deeply asleep. It clears out metabolic waste, harmful solutes, and crucially proteins like beta amyloid and tau. These are the sticky proteins that, if they build up, are strongly linked to diseases like Alzheimer's and Parkinson's. Impaired clearance is a real silent threat.
Wow. So if our brains are doing this vital cleanup every night and it's most efficient during sleep, does that mean even subtle disruptions like from our posture could have these long-term consequences we're just starting to grasp?
Precisely. It underscores the potential impact.
And that brings us neatly to a major health condition, sleep apnea. So many people deal with this, especially older adults. This is where your breathing repeatedly stops and starts during sleep. And it's a huge, often under-recognized risk factor for stroke. The American Heart Association figures are quite stark. About 34% of middle-aged men, 17% of women have it, and many cases just go undiagnosed.
Exactly. And sleep apnea directly escalates stroke risk in several ways. Those repeated breathing stops cause oxygen levels to plummet. This triggers stress responses, hikes up blood pressure, increases CO2 levels, and messes with deep sleep cycles. Over time, this constant oxygen deprivation damages blood vessels. It makes them stiffer, more prone to injury, and can even promote clot formation. All direct routes to stroke. And here's the critical link to position. For most people with sleep apnea, it's significantly worse when they sleep flat on their back, the supine position.
Right, compared to sleeping on their sides.
Yes. There was a clinical trial back in 2011 finding that simply avoiding back sleeping modestly reduced apnea severity in patients who'd already had a stroke. So yeah, changing position can make a tangible difference there.
It's really eye-opening, isn't it? How a simple habit can have such deep implications. So what does this mean for you listening tonight when you get into bed? We all have our preferred positions, right? But it turns out some of those common postures might be silently undermining your brain health, especially as our vessels get less flexible with age. Let's break down some specific positions and the risks they might carry.
Okay, let's start with sleeping flat on your back, the supine position. It feels restful to many, but here's the catch. It can actually hinder that brain cleaning system, the glymphatic pathway we talked about. It's just less efficient when you're flat on your back. This might lead to a buildup of those harmful toxins like beta amyloid, which multiple studies link to Alzheimer's. Johns Hopkins research actually found that sleeping supine for over 2 hours a night was way more common in patients with conditions like mild cognitive impairment and Alzheimer's. Harvard studies found similar links to higher beta amyloid levels.
And it gets even more specific, doesn't it? Like, what about tucking an arm under a pillow while on your back? I know I used to do that sometimes. Feels supportive.
It does, but it's problematic.
Yeah, the sources point out you're compressing the subclavian artery. That's a major vessel under the collarbone, feeding your arm and parts of your head. Squeezing it for hours slows blood flow, makes it turbulent, increasing the risk of clots, which can mean mini strokes or TIAs.
That's the mechanism.
Johns Hopkins found a 21% higher chance of mini strokes for people sleeping like that, and over 60. The risk tripled. I remember reading about Jennifer, a 58-year-old teacher. Multiple tiny strokes showed up on her MRI, and this exact sleeping habit arm under pillow was pinpointed as a major factor.
A stark example. Then there's sleeping on your stomach, the prone position. This forces your neck into a severe twist just so you can breathe. Think about that. for hours. You end up compressing one carotid artery, a main highway to the brain, while stretching the other. It significantly reduces blood flow.
And it's also bad for that brain cleaning process, right?
Correct. Less effective waste clearance, too. A University of Michigan study from 2021 found stomach sleepers were 33% more likely to develop plaque in their carotid arteries. Their arteries looked, biologically, about 10 years older.
10 years older, that's quite something. What about side sleeping? Many people think that's the safest bet.
It often is, but again, how you do it matters. That common habit of tucking an arm under your head while on your side, that's another risk point. You're compressing the brachial plexus, that's a nerve bundle, and the thoracic outlet, where major blood vessels pass.
So it's not just numbness in the arm.
No, it reduces blood flow to the arm, sure, but it can also create back pressure affecting circulation in the brain. Stanford researchers observed people doing this had, on average, 43 episodes of reduced brain blood flow per night, each lasting up to 3 minutes.
43 times a night.
Yes. Over years, this correlated with white matter lesions, little spots of damage on the brain linked to memory issues, and a 56% higher stroke risk.
There was Maria, 62, a nurse, healthy lifestyle otherwise, but developed memory problems. Her MRI showed brain tissue damage, and it was traced back to her consistent habit of sleeping with her arm tucked under her head.
And then we get into even more, let's say, contorted positions. The twisted pretzel.
Ah, yes, the pretzel. Sounds cozy maybe, but risky.
Very. This is where your upper body is twisted one way, lower body another. This stretches and bends the vertebral arteries. They supply about 20% of the brain's blood, running up through the neck vertebrae. Twisting them reduces blood flow, creates turbulence, ups the clot risk.
UCLA research found this position cut vertebral artery blood flow by an average of 67%. That's huge.
It is. And in people over 55, they found microclots forming in 41% of cases, leading to a nearly 5 times higher stroke risk over 3 years.
Wow. The anecdote about Thomas, 55, a construction foreman, he suffered a stroke in the back of his brain linked directly to this twisting sleep habit.
Precisely. And perhaps the most dangerous common position, the tight fetal position, chin tucked right down to the chest.
Why is that one so bad?
Because you're compressing both carotid arteries simultaneously. Remember, they supply 80% of the brain's blood. And you're also squeezing the jugular veins, which drain blood out of the brain. So you're restricting inflow and outflow severely.
That sounds really bad.
It is. Harvard researchers found people sleeping like this had over 100 episodes per night of severely reduced brain blood flow. After 5 years, 78% showed silent strokes on brain scans. That jumped to 92% in those over 60.
92%.
Yes. And over a third eventually had a major disabling stroke. Think about David, the 68-year-old accountant mentioned. Multiple silent strokes, completely unknown to him, linked to this tight curl he adopted for comfort.
These stories, these individual cases, really hammer home the potential dangers. But stepping back a bit, how do these specific positions connect to maybe deeper physiological issues, especially for older adults where things might be less resilient?
That's a really important connection to make. These risky positions can be strongly linked to things like cervical spine instability in your neck. Even subtle shifts or weaknesses in the neck vertebrae can literally pinch or compress those vital arteries, the carotids and vertebrals, disrupting blood flow into the brain. And just as importantly, it can hinder the outflow of cerebrospinal fluid, or CSF, which is part of that waste removal process.
So it affects both supply and drainage.
Exactly. And this can lead to those often puzzling symptoms people report.
Yeah.
Brain fog, dizziness, ringing in the ears, weird visual things, coordination problems, and even that feeling of just not getting enough oxygen. One source used a helpful, if slightly graphic, analogy: the brain toilet. If CSF flow is blocked, the brain can't flush waste. Toxins build up. In severe cases, they can essentially suffocate and drown neurons.
That's a powerful image.
It is. And a real challenge is that standard diagnostic tests, like an MRI, are usually done while you're lying perfectly still. They often miss the compressions or instabilities that only happen when you're in certain positions you might adopt during the day or, crucially, while sleeping.
Ah, so that explains why someone might feel terrible, like they're suffocating or foggy, but their scans look normal.
Precisely. The static image doesn't capture the dynamic problem.
That makes so much sense. It really changes how you think about those vague symptoms sometimes.
Okay, so given all these potential risks, especially compounded as we age, what can people do? How do we protect our brains while we sleep? What are the solutions?
Thankfully, there are effective strategies. One of the best recommendations is adopting what's called the cardiovascular neutral position. This generally means sleeping on your back, but with a slight elevation about 15 to 30 degrees.
So not flat on your back.
No, slightly elevated. And critically, your head and neck need proper support to maintain the natural curve of your spine. Not bent forward, not stretched back, neutral. You can achieve this with a good cervical pillow that cradles the neck, maybe a wedge pillow under your upper back, or even an adjustable bed if you have one.
And a pillow under the knees helps too, right? Yes. A small pillow under the knees eases lower back strain and stops you from sliding down. It keeps everything aligned.
No.
The beauty of this position is it uses gravity to help blood flow smoothly to and from the brain. Steady oxygen supply. Some studies suggest it could potentially cut stroke risk by as much as 43% compared to those dangerous postures.
43%, that's significant.
Very. Plus, it helps with that glymphatic drainage, can ease acid reflux, and often reduces snoring and sleep apnea symptoms. It's a win-win-win.
Okay, that sounds ideal. But what if you're just really a side sleeper? Many people are.
Optimized side sleeping is definitely a good alternative, especially sleeping on your left side. Research suggests the left side might be slightly better for glymphatic waste removal, clearing out beta amyloid and tau. So potential benefits for reducing Alzheimer's and Parkinson's risk down the line.
Left side specifically. Interesting.
Yes, though right side is still much better than the risky positions. Left side sleeping also improves general circulation, takes pressure off the heart, aids lymphatic drainage, and is often very helpful for sleep apnea sufferers. The key is how you side sleep. Avoid tucking that bottom arm under your head or the body. Keep arms out in front, maybe hug a pillow. Use a pillow between your knees to keep hips aligned.
So pillow choice matters more than just comfort.
Absolutely. It's functional. For back sleeping, studies show rectangular pillows often provide better comfort and reduce neck muscle tension. For side sleeping, cylindrical or contour pillows that fill the gap between your head and shoulder are often better, reducing strain on neck muscles.
What about material, memory foam, feather?
Studies found memory foam and wool pillows performed similarly well in terms of comfort and reducing muscle activity. So some personal preference there, but the main thing is proper support for your neck's natural curve.
And using pillows as barriers.
Yeah, that's a great practical tip. If you tend to roll onto your back or into a twisted position, strategically place pillows around you. A body pillow can be great for preventing twisting if you're a side sleeper. Pillow between the knees for alignment.
Makes sense. But changing habits is hard, especially sleep habits.
It takes time. Be patient with yourself. The advice is to just start the night in a better position. Even if you move later, you're training your body. Some people use gentle vibrating alarms on smartwatches if they detect a bad position, though that might disrupt sleep for some.
And addressing stress is important too.
Definitely. Stress and anxiety often make us curl up tightly. So relaxation techniques before bed, deep breathing, gentle stretching, mindfulness can help you settle into a more open, relaxed, and safer posture.
When should someone definitely see a doctor about this?
If you really struggle to find any comfortable position, if you have trouble breathing when lying flat, or if you're consistently waking up feeling unrefreshed, excessively sleepy, or foggy despite getting enough hours, those are red flags. Don't just chalk it up to bad sleep. Consult a healthcare professional. There could be underlying issues like severe sleep apnea, cervical instability, or other conditions that need proper diagnosis and treatment.
That's crucial advice. Because while optimizing sleep position is this incredibly powerful, often overlooked tool, it's still just one piece of the puzzle, right? It fits into the bigger picture of holistic stroke prevention, especially relevant for maintaining health and independence as we age, something we really want to emphasize for older adults.
Exactly. It works best in concert with other key lifestyle changes. Our sources really hammer this home. Think of it in maybe three main buckets. First, know and manage your numbers. That means blood pressure aiming for optimal, under 1280, keeping an eye on cholesterol and blood sugar, and maintaining a healthy weight.
Okay, numbers first. What's second?
Second, embrace a healthy lifestyle. This is the big one. Eating well, focusing on fruits, vegetables, whole grains, lean proteins, healthy fats, cutting back drastically on saturated and trans fats, sodium, added sugars. Regular physical activity is non-negotiable. Aim for that 150 minutes of moderate activity, like brisk walking, or 75 minutes of vigorous activity per week, plus muscle strengthening twice a week.
And the big don'ts.
Absolutely critical. Don't smoke or vape. Avoid secondhand smoke. Limit alcohol significantly. The recommendation is usually no more than 1 drink a day for women, 2 for men. Often less is better.
Got it. Numbers, lifestyle. What's the third bucket?
Third is proactive medical management. Take any prescribed medications exactly as directed, especially for blood pressure or cholesterol. Work on stress reduction techniques that work for you. And, crucially, have regular medical checkups to monitor everything and catch potential issues early. These pillars, combined with optimized sleep posture, create a really robust defense against stroke and support overall brain health as you age.
Okay, let's try and unpack this one last time as we wrap up. We've gone from the big picture of stroke risks down to the very specific micro-level details of how your posture in bed can impact your brain's future. It's an area of self-care, honestly, that most of us probably haven't given much thought to.
And it really does raise an important point for everyone listening. Just recognizing the potential impact of something as seemingly simple as how you sleep. Well, it can be genuinely life-changing. These small, consistent adjustments, especially as we get older and our bodies, our blood vessels become a bit less forgiving, they matter. Protecting your brain while you sleep is a tangible, proactive step you can take every single night to help maintain your independence and your cognitive vitality for years to come.
So tonight, as you get ready for bed, here's a thought, a challenge. Just pay attention for a moment. Notice how you naturally settle in. Ask yourself, is this position helping my brain? Or could it be quietly, subtly contributing to a risk I never even considered? What one small change could you try tonight? Maybe aiming for that cardiovascular neutral position. Or just making sure your arm isn't tucked under your head if you're a side sleeper. Be mindful, be proactive. Your brain will absolutely thank you for it. Thank you for diving deep with us today.